Millions of American people in the United States live with eye conditions that can cause blindness if left untreated. Age related macular degeneration, or AMD, is one of the most common causes of vision loss later in life, affecting millions of Americans. Now, February was AMD Awareness Month, but today I have Dr. Talia Kaden, ophthalmologist at Manhattan Eye, Ear, and Throat Hospital. Good morning. How are you, doctor?
Good morning. Thanks for having me today.
Well, thank you for joining us today. So, what is age related macular degeneration, AMD, and what does it tend to affect?
Sure. So, age related macular degeneration, as you alluded to, is a disease that impacts over 20 million Americans. And it's a disease that impacts the retina, which is the back of the eye, something like the film in a camera, and particularly the macula, which is the central part of your retina and allows you to see clearly. In wet macular degeneration, which impacts about 1.5 million Americans, you develop abnormal blood vessels in the macula, and these blood vessels can leak and bleed, and they can cause permanent vision loss.
Now, what are the risk factors and symptoms of what you call wet AMD?
Sure. So the risk factors, some of it is age. It's age related. So being over the age of 60 puts you at higher risk for it. It's more common in women. It's more common in people who have high blood pressure or who are obese or who smoke. And also having a family history of the disease can be a risk factor for it. In terms of the symptoms, some of them are pretty nonspecific. So things like blurry vision or having difficulty watching TV or driving. But you can also see if you notice some changes in terms of the quality of your vision. So if straight lines start to look wavy, I often tell my patients if their bathroom tile or if they're looking outside at a flagpole and you see that that doesn't look straight anymore, then that's a reason to go and see your eye doctor immediately and make sure that there's nothing going on, including something like wet macular degeneration.
Well, how is this treated and what are the current treatment options?
So we have some really wonderful treatments that have been around for about 20 years, and there are a number of options. There are injections of medication that go inside the eye, and these injections are given anywhere from once every month to every 2, 3, or even 4 months. The most recently approved medication is a medication called Vabysmo. But as with any treatment, any medication, we always recommend that you talk to your eye doctor about what the right treatment option is for you.
Now, what should older adults and caregivers know about AMD prevention?
So some of it is just good health, it's good eye health. So avoiding cigarette smoke, cutting down on smoking, eating lots of green leafy vegetables, these are all things that are good for your eyes. But the other thing to pay attention to is making sure, as I said, you've got to see your eye doctor every year, especially if you're over the age of 60. And you want to pay attention if you notice any changes. So if you're a caregiver and the person you take care of is complaining that things don't look the same, things look blurry, you want to make sure to get them in to see their eye doctor as soon as possible. Because again, the earlier we treat, the better.
It sounds interesting. Now, where can our viewers go for more information?
So if you're interested in the medication I mentioned, you can go to vabysmo.com. But if you're looking for information about the disease itself, for information about the symptoms or treatment, I always recommend the American Academy of Ophthalmology, AAO.org, or the American Society of Retina Specialists, ASRS.org. And both of these are wonderful websites. They have a lot of great resources, including things you can print out, share with your family, and give you a lot more information.
You got my attention. I think I'm going to check out those websites for myself. Dr.
Good. And
Caden.
go see your eye doctor.
Yeah, I will do that. Dr. Caden, thank you so much for joining us on Morning Blend.
Thanks for having me.